regulations regarding COVID-19 anymore. It is our responsibility to keep each other safe and ensure that Wolf 11 is a pleasant experience. In case you have any symptoms of COVID-19, we ask you to be cautious and self-isolate. If you need medical help, please dial 112 as indicated on the back of your Wolf 11 badge. Kindly note that this session will be closed for in-person attendance once the maximum seating capacity is reached. Thank you. Excellencies, distinguished delegates, partners, colleagues and friends, as we open this special session on health, which we have organised in partnership with the World Health Organization, the UN Regional Economic Commission for Europe, and the Global Commission on Drug Policy and Geneva Cities Hub, I'm very pleased to invite you to a session that touches all of us. While many of us have undoubtedly enjoyed a better standard of health than perhaps our parents and grandparents, and we benefited from huge advances in medical sciences and technology, our changing world has meant we are now exposed to a range of new risks and threats to our health. When we add this to the effects of urbanization, of migration, of climate change and ongoing conflicts in many regions, life expectancy in many places has been reduced. This may be due to poor lifestyle choices, or indeed in many parts of the world due to the effects of living in an unsafe environment. In recent years, there's been growing awareness that if we pay more attention to how we live and take a closer look at the living environment, we can help people to live more healthy and productive lives. For many citizens, however, poverty and inequity has meant that illness and death from easily treatable diseases still takes many lives, both young and old. There are other vulnerable people in society with disabilities who we must also take into our care. The COVID pandemic, like many others before, and indeed those in the future, has shown that diseases can quickly reach pandemic proportions and have far-reaching economic and social impacts. So it's against this background that today's session we'll try and cover some of these issues in urban settings and how we can look for improved ways of urban design to protect our societies and the most vulnerable, and how we can make the living environment in urban settings better for people of all backgrounds. The first session of the sessions this afternoon will be a panel from high-level executives from many of the agencies who we work with, and I would like to introduce the first speaker, who is representing our executive director, and this is Mr. Chris Williams, who is the director of UN Habitat's New York office. Chris, please give your address.
Thank you very much, Graham, and greetings to Assistant Secretary General Yamamoto and colleagues from UNECE, as well as the Asia Infrastructure Investment Bank, the Global Commission on Drug Policy, Barcelona Institute for Global Health, and Youth Representative. Thanks very much for coming. It's a pleasure to be here at this session. As Graham had indicated, I'm putting forward the comments of our Executive Director, Maimouna Sharif, who serves as the Undersecretary General at our organization based in Nairobi, Kenya. Over the past 3 years, our whole perspective of health and its management has been changed and caught up by the COVID-19 pandemic. The wide-ranging impacts on all aspects of our lives could never have been anticipated. Not only has the disease taken its toll on so many, it has also reduced the ability of national governments and cities to provide life-saving medical services for a variety of other diseases, not just COVID, cancer care and neglected tropical diseases. This has all happened against a backdrop of the climate emergency. This combination of climate change and urbanization means patterns of disease incidence and prevalence will change. Aside from diseases, the impact of climate on the most vulnerable, for example, the heat waves in cities and their impact on the elderly, has already proved to be a health emergency in some settings. In the past few years, perhaps more than any time before, there is greater understanding that the responsibility of health now goes beyond the, quote, traditional health sector. This is true for both preventable diseases, such as chronic illnesses and non-communicable diseases, managing contagious diseases, and, of course, managing pandemics like COVID-19. In addition to the tragic outcomes for so many, COVID-19 pandemic was, in a sense, an X-ray machine. It allowed us to see the huge health inequalities in urban settings in both wealthy and poorer countries. The pandemic also highlighted the critical role of local and regional governments, what they play in providing both preventive interventions as well as managing disease pandemics. There were many cases from around the world where rapid and decisive action taken by city-level municipalities minimized the casualties while balancing the need to keep the local economies alive. Local governments were very much at the center of this activity, both in response and recovery. The time is right now to use the momentum of COVID-19, and there are great opportunities to build on this experience. As we look to the future, management of health will benefit from a multi-sectoral approach driven by cities to adapt our urban environments to achieve better health outcomes. This new approach to health will require good partnerships to be developed with both within and amongst cities. For UN Habitat, we have sought to explore these partnerships as an important first step, and after many years of collaboration have developed a new systematic agreement with WHO that has been informed by the UN system-wide strategy for sustainable urban development. This agreement was signed by our Executive Director, Maimouna Sharif, and the Director General, Dr. Tedros from WHO, just last year. It has enabled us to combine our knowledge on urban systems and structures and governance together with WHO's expertise in managing diseases and well-being. I mention well-being because good health is much more than the absence of disease. In the complex society in which we live, with the many inequalities that exist, we are seeing huge increases in mental health problems. This can trigger violence, crime, and substance abuse. Distinguished participants, as we pursue this discussion today, I want to underscore that we have a great opportunity to rethink urban space to make our cities and towns not only healthier and greener, but also safer and more secure. As has been said in many of the sessions already, many of the urban spaces have yet to be built. For this reason, we need a two-pronged approach. On the one hand, we need to rethink our existing urban centers, including more greener spaces and reducing sickness risks to ill health, including injuries and accidents. On the other hand, we need to lay down the guidelines, norms, and standards for the new cities yet to be built. This will create actions for planners, engineers, and investors to work in partnership with our health sector experts. Later in this session, you will be hearing some examples of how our collaboration has already achieved some impact. For example, our work on the urbanization of malaria and our initiative with mayors entitled Healthy Cities, Healthy People. In conclusion, these and other new approaches must be picked up by investors in cities of the future. If we can ensure that the health considerations guide some of the investments in housing and infrastructure, we can look forward to some healthy and productive lives. Please take the opportunity at the World Urban Forum, not just today, but throughout the sessions, to continue with this important discussion. I wish all of you the best of your deliberations and would like to thank all the distinguished guests and speakers for their support. Thank you very much.
Thank you very much indeed, Chris. I'd like to now come to our second panelist, Dr. Naoko Yamamoto, who was most recently WHO's Assistant Director General for Universal Health Coverage and Health Systems. Dr. Yamamoto brings nearly 30 years of experience working on health in Japan and served as a Senior Assistant Minister for the Global Health in Japan's Ministry of Health, Labour Welfare. In this capacity, she's heavily involved in Japan's global health leadership, including hosting and organising the International Conference on Universal Health Coverage in 2015. Dr. Naoko, we're very delighted to have you, and can I invite you to share with us your words of wisdom, please?
Thank you very much, and it's a great pleasure to join. And we have, I can see the old people, so we have more interactive discussion. So Chris has already given us many overviews, many important elements. So let me start as a WHO, what is up? So for me, I should say 3 issues. First, during this wolf, many people say that 70% of the global population will be living in urban setting in 2050. We heard lots about it. Means many people living in the urban, whereas urban they born, develop, and learn, and work, and enjoy, and aging, so on. But still, our urban setting is not safe enough, not healthy enough. That's the issues. It's the biggest challenges. So the food we eat is still not healthy and safe enough, and the air we breathe not so clean, and the drinking water to drink is not safe enough. And I see the WHO estimated that more than 90 people in urban area breathe polluted air, and 40% of the urban rural has no access to safety managed sanitation services, and as I said, that many lack of access to adequate drinking. So how we can make the urban setting more healthy and safer with all partners? This is our challenge. Second issues, I definitely need to stress the equity issues. Access to the water, the housing, working condition, many issues is we need to highlight health equity and health, not only the health but equity issues. And the third issues is again, because not only because of COVID-19, but the world urban setting is not safe enough and is not ready to prepare and response and resilient for the health emergency, not only the pandemic, but also many other natural disasters, many other settings. So that big And the other issues is at WHO, we really would like to keep some evidence and the science and data, including disaggregated data to highlight the equity issues and monitor our progress. And finally, the partnership of all people and how health sector influence people, but also how other sector use health sector to address these issues. So I'm looking forward to the more deep discussion with you. Thank you.
Thank you very much indeed, Dr. Naoko, for your great speech.
Thank you.
And I'd now like to move to our second distinguished panellist this afternoon, Mr. Dimitri Mariassan, who is appointed as Deputy Executive Secretary of the UN Commission for Europe at the beginning of March 2021. Prior to joining UNEC, Mr. Mariassan was the resident representative of the UN Development Programme in Armenia, and he's had very other sort of teams leading various UN bureaus in various places. Mr. Mariassan holds a PhD in economics from Moscow State University and a master's in public administration. Dimitri, we look forward to hearing your thoughts on urban health.
Thank you very much, Assistant Director General Yamamoto, colleagues. First of all, thank you for inviting UNEC to this panel. Our appreciation goes to UN Habitat and all the organizers. Secondly, you know, when writing the talking points for me, my team started with the COVID-19 pandemic as an obvious angle when which you touch when you say health and cities, because we know that cities were disproportionately affected at all levels, health-wise, socially, economically, by the pandemic. And my main, point on this is that, we've learned so many lessons from it, and as Naoko mentioned, we should not let the next major medical emergency takes cities by surprise. Because I think the death toll and the toll to human health and social exclusion is still to be counted on COVID, including a major mental health crisis, which is often a hidden crisis for many years before it surfaces in so many different ways. And I think cities will need to make sure next time they do better. They were very often at the front of the best responses as well, and national governments very often followed suit to what cities did. But clearly this was a first in scale, and so many lessons were learned. Just earlier today we had a session where we reflected on a joint program that all 5 regional commissions, Habitat and several other partners implemented precisely to help a number of cities around the world to cope with the consequences of COVID-19. I will not go into the details, but as any major disaster that really tested the capacities of cities, made their needs for financing so clear, and finally made it even clearer that responding to a health emergency is not a health department responsibility. It is very much a citywide, government-wide responsibility, and next time around we really need to be good at doing this. So we can share more information on the results in the 16 cities, but I'd like to speak about some other elements of urban health today. First of all, we believe that urban health considerations have to be integrated into urban planning. It's not about responses, it's about designing our cities differently, designing infrastructure, urban spaces, city government, even interaction with citizens and feedback loops completely differently. And we hope that the initiative we are spearheading with UN Habitat, with Housing Europe and others, called Housing 2030, will give us all an opportunity to do it right. So health considerations are very important in this initiative, and you can check out a very thick but very practical Housing 2030 publication, which we're very proud of, together with Habitat and others. Secondly, at the regional level, and I'm representing one of the 5 regional commissions of the UN, and at the regional level in our broadly defined European region from Canada to Tajikistan, so it's not just Central Western Europe, but many more countries, we have developed an action plan, Peace and Life in the UNICE region. It's a very sorry, not peace. No, peace is really on my mind right now. Apologies, I stand corrected. Place and life in the UNICE region. It talks equally about the urban spaces, for example, a 15-minute walkable city, which in my view is extremely important from the health point of view, because a looming obesity crisis globally and in this region is a really important health problem. And walkability instead of drivability is becoming a test to the quality of life in cities. But it looks at many other considerations, including general quality of life, access to services, affordability and quality of housing. And I want to emphasize how important housing is from the health point of view, be it the quality of indoor air, be it the temperatures in the houses, or be it the materials from which houses are built, including toxic and otherwise hazardous materials. So that is the second illustration of when I say design cities differently. Thirdly, greening, urban greening. We talk about it in all the climate and environmental events, but we have to talk about greening at health events as well. Because ultimately the world is suffocating, and ultimately the climate emergency also points to the fact that there is just much less clean air. And urban greening is a big priority for UNICE. We have Trees in Cities campaign, which is part of a Bond Challenge launched a few years ago by a number of governments. We have millions of trees being committed and planted in the region, and more to come. And one good example, just recently we signed an interesting project, a partnership in Uzbekistan, where the government has decided to put urban afforestation at the core of the government program. Next, informal settlements. I think Habitat will be better place to talk about it. Just to tell you that as part of our regional recovery plan for informal settlements work, we've helped a number of countries in our region to come up with thinking through how specifically the informal settlements, where health problems are often concentrated, can be tackled. Next, water, quality of water. There is a very important work we're doing together with WHO. It's hosting the Protocol on Water and Health. It sounds technical, but actually the quality of water we drink is not technical. It's about life. It's about ultimately health outcomes, especially for children, and it is about access to sanitation. Even in the so-called pan-European region, which is supposed to be the most developed of all the 5 regions of the UN, there are thousands of school children that do not have access to running water or to clean toilets still today, and we need to be very clear that this is not only in rural areas, but also in urban areas, and yes, mostly in secondary cities, but we should not forget about toilets in secondary cities as a major constraint to health in urban areas, even in the European region. Imagine what the situation is like elsewhere. Finally, mobility and road safety. I cannot finish without mentioning the two. Another great example of partnering between UNICE and WHO is the Transport, Health and Environment Pan-European Program, the so-called the PEP. The PEP is the first and only international program designed to integrate environmental and health aspects into transport, mobility and urban planning, taking all three together, urban, transport and health. And I think this is exactly the kind of intersectoral approach we need. PEP is very concrete. It focuses a lot on bicycling and other non-vehicle-based movement, and this is another critical element. Finally, road safety, a theme very dear to our hearts. Literally in 2 days, there is a high-level meeting on road safety in New York. Many of us will be there. This is a moment when the world needs to be reminded that 1.3 million people die every year. Unfortunately, they die every year no matter what. This is not a fluctuating number. It's only slowly growing up, and 50 million more every year, I emphasize, get injured. And that is a silent pandemic, as we call it. And many of those injured are children. Most of them are young people. So from my perspective, and obviously most of these deaths and injuries occur in cities, and for cities, road safety, in my view, is one of the biggest challenges to be addressed in the next decade, the second global decade on action for road safety. So I call on you to please pay attention to that agenda. Habitat, WHO, all others here are great partners in this endeavor, and we stay committed to work together on this. Thank you very much.
Thank you very much indeed, Dimitri, for your great delivery. Our next speaker on the panel is actually joining us online, and he is Dr. Michael Sidibe. Dr. Sidibe, after an early career in UNICEF and UNAIDS, in 2019 was appointed Minister of Health and Social Affairs in Mali, and then latterly he was basically appointed as the second director of UNAIDS. So we're so glad that you could manage to join us online, Dr. Sidibe, and we look forward to your intervention, please.
Thank you. Thank you very much. Sorry, I would have loved to be with you there, but unfortunately, we had a problem. The flight was delayed, and I am in Warsaw in the hotel room. But I was listening carefully, and I found these introductory words very timely and topical. I am honored to represent the Global Commission on Drug Policy for the first time at the World Urban Forum. Cultural figures and globally influential personalities to contribute to the world debate on drug policy. Today we are 26 commissioners advocating for a more efficient, evidence and human rights based and public interest approach to drug control. The war on drugs and the resources dedicated to a world without drugs saturated political attention without achieving the expected result. In fact, production, trafficking, and drug use has increased over the past 50 years, and criminal organizations continue to be the only beneficiary. The current drug control regime generates violence, increases prison population, fuels inequality, disease, and poverty. And although there have been certain reforms moving towards a more realistic approach, much has still to be done. Marginalized communities and minorities, including people who use drugs, are the ones carrying one of the heaviest costs of current policies. In this sense, as a solution, the Global Commission on Drug Policy has outlined 5 pathways to drug policies that work, and these are: first, putting people's health and safety first; second, ensuring access to essential medicines and pain control; 3, ending the criminalization and incarceration of people who use drugs; 4, refocus enforcement responses to drug trafficking and organized crime; and finally, regulate drug market to put government in control. Note that the first 4 pathways do not require any reform of the International Drug Control Convention. So why cities? Cities are the cornerstones of the change we want to see. Large cities in particular often bear the brunt of national drug problems and the consequences of national drug policies. Cities have to confront public disorder caused by drug dealing, social and public health issues resulting from problematic drug use, and the high cost of enforcing a prohibitionist drug legislation. This trend will only increase as the city will host 68% of the world population by 2050 and concentrate a larger number of socially vulnerable people. Even if punitive drugs laws were adopted at the national level, cities have a pivotal role to play. Cities have the scope to confront the problem created by repressive drug control. And cities can have the legal flexibility to design and implement pilot projects that alleviate the harm caused by punitive national drug policies. We encourage cities to decriminalize drug use and to offer a wide range of voluntary harm reduction services for those in need. We also ask mayors to instruct their municipal police to stop the harassment of people who use drugs, who do not harm others. The fear of arrest and fear of violence should no longer prevent people suffering from drug dependence from accessing the services to which they are entitled to. Cities must ensure that local drug policies are coherent and provide a platform to include everyone involved, in particular affected communities and civil society. In conclusion, cities and municipalities can be the most efficient agents of change. Some examples can illustrate this. 30 years ago, cities like Bern and Frankfurt took courageous steps to de facto decriminalize drug use and open the first safe consumption rooms. Other examples include the Prague Declaration and its 7 core principles for effective local drug policies. Vancouver officially licensed cannabis retailers in 2015 before Canada's legal regulation in 2018. More recently, New York opened the first consumption facility in the United States in a move to halt overdose death in contradiction with the federal law. I invite you to read the Global Commission's position paper on drug policy and city government and its concrete recommendation. And please note that we remain available to support cities willing to review its approach to drugs. Thank you very much for giving me some time to share this point with you.
Thank you very much indeed, Dr. Sibi, and we're very pleased that we could enable to connect to hear your words of wisdom. Thank you very much indeed. We now go to the last, but by no means least, panellist in this first part of the session, and I'd like to introduce Madam Olufen Taiwo. Olufen is a chartered town planner with experience of working in public, private and non-profit sectors. She's a doctoral researcher at the Institute of Risk and Disaster Reduction at the University of College London and leads the Commonwealth Association of Planners of Young Planners Network as the convener. She was awarded the Royal Town Planning Institute's Special Presidential Award in 2020 and 21 for her contribution to promoting diversity and inclusion in the planning profession. She was also recently recognised as the Planner Woman of Influence in 2021 and 2022. So, Olufen, please, we look forward to your intervention.
Yeah. Thank you very much, and Madam Secretary and everyone. It's actually very interesting. Assistant Director General, you mentioned some of the points I was going to touch on, as well as Assistant Deputy Director General as well. It's very important to understand that the challenges facing young professionals, young people across the globe, it's not different from the health challenges facing everyone globally. And if we then look at the climate change issues, and if we particularly consider that over 50% of the world population, 60% would be living in an urban area, and if you then look at the Commonwealth, where this is where it would be over 60% of the population would be under the age of 30. So the challenges remains the same, and it's increasing gradually. But then one of the main issues that I would touch on is the lack of accessibility to social, environmental, to social, physical and cultural environments have actually led to the poor health and well-being of young people and of young professionals globally, and that's one of what we are also facing within the Commonwealth. Really, because without having a very good social environment to interact, there would be increase in mental health challenges, and we are already seeing that across globally. The stressors increased. The need for sustenance is also very important, and with the economic challenges, it definitely increases a lot of stress and anxiety, and this leads to mental health issues and other issues as well. If we look at the physical environment, Deputy Director General, you've talked about the issues around walking, around recreational spaces. This is absent, and there's this adage about what if we need to learn what the previous generations, what they did right, so that we can implement that and we can learn that. With this, there's innovation, there is a technology, there are new ways to do things, new ways to improve our health, to address the health challenges. But with these new ways, we need to understand the fundamental principles, and fundamental principles don't change. And I believe that this is lacking with our generation and with a lot of generations coming after us if we're not careful. So there is that need to work together to really understand exactly the core principles of health, of well-being as well. And also, there is a need for us to work together. It has been mentioned on the panel already, the fact that health emergencies and health issues, well-being issues, it's not just a problem of the medical expert alone. It's the challenge of everyone. It's a multidisciplinary approach because we live in a city, and city is not a cellular object. It's multicellular in its approach. So we have to all work together. The engineer, for example, would not say that health is not their business in where we are going. They have to consider that. The planner definitely should know that it's important to consider that, and the architect as well as not leaving the politicians as well in this conversation. These are some of the things that needs to happen at local level, at regional level, at national level, and at international level as well. There is that need to come together to continue to look at how can we speak the same language, how can we understand each other's objectives, and how can we maximize the resources available to achieve the results that we need to achieve in terms of our health and well-being. These are some of the issues. I also want to touch on the road safety matter, which is a very serious issue. But we also have to look at, it's not just a transport issue. It's not for the transport industry or the mobility sector's concern alone. It's still a challenge faced by everyone, and we need to work together to really address that. It's not something a sector can do on its own, and I believe these are some of the points that we need to touch on as we go on. Thank you.
Thank you very much, Charlotte. Well, I'd like now, we've come to the end of this panel and we're moving now to the keynote session, but I'd like us all to thank once more all of the panellists for their interventions here this afternoon, and I can invite you to leave the podium, please. Thank you very much. Ladies and gentlemen, I'd now like to introduce our keynote speaker this afternoon, who is Professor Mark Newhouse from the Barcelona Institute of Global Health. Mark is a PhD research professor and director of the Urban Planning and Environment and Health Initiative and Air Pollution and Urban Environment Research Programme at IS Global in Barcelona. He's a world-leading expert in environmental exposure, epidemiology and health impact assessment. And in fact, in 2018, 19, 20 and 21, he was among the 1% most cited scientists in the world, and he was ranked as #1 scientist in urban health in 2020 and 2021. So I think that is quite enough, but Mark, we're looking forward to your presentation.
Thanks so much, Graham. Please could I have my slides. Many thanks for inviting me to speak here. I mean, it's on my favorite topic, as many of you know this. So it's great, and that you're here this afternoon. I know it's been a long day. What I'll be talking about is, can I have the slides here also on the front so I can see my own slides? Otherwise, I don't know what I'm talking about. I can't see them here at the front. Some of the themes we already heard from others. So, and I think what I'm doing is putting some numbers to the themes. I mean, what we've heard, because we know that they're all fairly important. First of all, what are some of the lessons that we've learned actually from COVID-19? I think some of the major risk factors we've seen are like age, genes, gender. Unfortunately, we can't do so much about them. But we need to take care of them and look after those people that have it, they're getting it.
The other risk factors are pre-existing disease. What we see in diabetes, hypertension, obesity, those were at much higher risk for severe COVID-19 disease and mortality. Often this is due to the lack of physical activity and unhealthy food environments that are leading to many of these diseases, and we could do something about them, I believe. Furthermore, we saw that people that live in high air pollution area were much more likely to get the disease and also die as a result of COVID. I mean, there's very good evidence coming out for this, and also the less well-off. At the same time, also, we saw that in our cities, there was not enough public space to keep the distance. I think we saw quite a lot of crowded places when people were out there. We had to wear masks because there was not enough space. And also, we saw that people were looking for green spaces. I've never seen green spaces so crowded, because where people were looking for stress reduction and restoration, because we had so many mental health problems, and actually going to green space helps. We know that. We've got very good evidence for that as well. So I think what we need is healthier environments, healthier urban environments, and also healthier and more resilient populations, so that, you know, the next time we're prepared for to face another outbreak. Here I've got a number of urban health challenges, what I believe, and I'm a bit biased and I've got only 50 minutes to talk about things, but what are coming up, what I think are extremely important, and I'm going to show you a few numbers a bit later to back up the case. First of all, air pollution, I think it's an extremely important issue for many cities. We see that cities are hotspots of air pollution. Climate change in particular, we've heard it before. Also the lack of green space and biodiversity in our cities, I think it's a real problem. And then we see also what we always have, the issue of poverty and inequality. And these things are all coming together. They're all mixed, you know, they somehow linked together, what I'll come back to later. The other thing is, I think, is the challenge of governance. I mean, we're still not doing so well for in urban health governance as such, but also including urban health in city governance. I mean, putting together indicators, policies, and also monitoring to keep an eye on urban health issues. And I think that's a problem. I think urban health doesn't still have the importance that some of the other issues have in cities, and often economic interests dominate actually, and health issues come a bit to the side. Also the models that are being used, cost-benefit analysis, for example, often don't include the externalities that we see for many policies that are being introduced. There are many other issues that I could talk about, but I won't. We know that urban health has many different issues. But let me give you a few numbers. I mean, this is a study that recently came out from Susan Annenberg and her group, where they looked at 14,000 urban centers. They estimated that almost 2 million premature deaths happened as a result of the current air pollution levels. We know air pollution is extremely deadly. It's a slow killer. But it's not only that it kills people prematurely, but it also causes cardiovascular and lung disease. It leads to cancer, lung cancer in particular. It affects our brains. It affects our cognition from children, slower development of cognition, what we see, and also the elderly that are declining much more rapidly and leading to Alzheimer, what I think it's important as well. And it also affects the fetus. We know babies are born with a lower birth weight, and that's the disadvantage is being carried on for the rest of their life. So many other things are happening, but these are just to mention some of them. Climate change. We're very aware of the issue of climate change. We think about heat island effects, for example. We know that city centers can be 4 or 5 degrees hotter than surrounding areas, and we know that extreme heat kills people. There's a study from Ho Chi Minh City in Vietnam, where they estimated that almost 0.5% of premature mortality during these months was caused by the extreme heat island effects. At the same time, we know also that greening actually can reduce the heat island effects, and there are many examples now coming. And they also estimated that they could prevent premature deaths by greening the city a bit more. But of course, when you think about climate change, it's not only about urban heat island effects. There are many others, and flooding is one of them. Just before this session, I was listening to someone from the Philippines who was saying that they're having great problems at the moment in the Philippines with flooding and cities disappearing as a result of rising sea levels. Here we can see also that, cities are some of the problems, because 75% of greenhouse gas emissions are actually resulting from cities. So cities could do something about this with their policies. And also 24% of greenhouse gases come from traffic. Traffic is a big issue, as I will talk about as well. Finally, for some numbers, recently we did a study in 1,000 European cities. We found that 60% of the population had insufficient access to green space, as defined by Matthias and his group, that we need to have a green space of at least 0.5 hectares within 300 meters of the residences. And if we would increase green space in our cities, we could prevent 43,000 premature deaths each year in the European cities. That's a very large number. Also, we know that increasing green space can lead to fewer mental health problems, better cognition in children, and also in the elderly, better mood. People tend to be in a better mood in a green space. And also we see healthier babies. So there are many benefits of greening, what we've heard already before. One of our big problems in our cities is the domination of the car. Even though in many cities the car is not the main mode of transport. This is my city, Barcelona, and only 1 out of 4 trips are actually by car. Most of the trips are by public transport. But when I look around, it looks like that everyone goes by car. And we know that 60% of the public space, that includes roads, parking, is actually taken up by infrastructure for the car. So it's not the car per se, but it's the public space that it takes up. That is one of the big issues, I think. We could use that space in a much better way and to make it much healthier. We did a health impact assessment of the current impacts of poor urban and transport planning, what we call it in Barcelona, and estimated that almost 3,000 deaths, premature deaths each year resulted from this. Most of the deaths came through the lack of physical activity, but also because of the air pollution levels, the noise levels. People tend to forget that noise also kills people. The heat island effects, the extreme heat, and also green spaces. So about 20% of the premature deaths are related to urban and transport planning. So I believe we need to do something about it. We can't keep sticking our head in the sand. We really need to think. We need to come up with new ideas, perhaps new urban models. I think recently a few new urban models have been proposed. Let me first start off with the 15-minute city. It was already mentioned. The brainchild of Carlos Moreno. I think he's also around here at the conference. The idea that all our destinations, school, work, cultural events, shops, should be within a 15-minute walk of our residents. I think it's a great idea, but it really needs to lead to a remake of our cities. At the moment, a lot of our cities are segregated by social economic class. I mean, this also means that you need to start mixing people. The way they look at it in Paris is they put more events, more destinations in the neighborhoods so people can walk to them. But, the main trip that people are making often is going to work. So you would need to bring the cleaner closer to the house they're cleaning, is my kind of interpretation. But the other thing is the low traffic neighborhood that's been pioneered in London, seems to be fairly successful. It's more temporary, but then other more long-term are like the car-free neighborhoods, like what we have in Vauban in Freiburg, a wonderful neighborhood, lots of green, no cars, good public transport to the city center, and people seem to be very happy. The problem is only that it's so popular that the houses are very expensive, what is one of the disadvantages. And then finally, a new urban model that's at the moment pioneered in Barcelona is the Barcelona Superblock. I want to introduce you to this for those that are not familiar with it. I'm sure many of you have heard about it. Many cities, including Barcelona, have a grid system, which you see at the moment on the left side. Traffic goes up and down, left and right. A lot of traffic in Barcelona. We're dense. We're a compact city with a high traffic density. The idea of a superblock is to cut off the junction of 9 blocks, 4 junctions and 9 blocks, and only allow active transportation inside there, or people that have their own car that don't need to cross through it, and also increase the green space. So the idea is to create 500 superblocks in Barcelona. Unfortunately, we haven't managed to create so many of them. There are 3 of them, and this is one of them, to give you some idea. This is in Sant Antoni. On top you see what it was before the implementation, and at the bottom after the implementation. The photo is taken in the afternoon, people having their siesta. It's still important in Spain, as you know. But not so many people around, but you can see that there are no cars, people walking around, and there's opportunity for people to sit down. We did a health impact assessment for what if we would implement the 500 superblocks in Barcelona, and we estimated that we could prevent almost 700 premature deaths as a result of the implementation. And that's because we reduced the air pollution, the noise, heat island effects, increased the green space, and also the physical activity. Here you see the largest impact is actually because of the reduction of air pollution, and the smallest is because of the increase in physical activity. Physical activity is underestimated because we don't have good data on how physical activity actually may change, so we were very conservative in this. But you can see that introducing a new urban model and a new urban design actually can prevent mortality and also disease. We're looking also at mental health, and we see even larger benefits from this. Now, some of these changes you can't introduce so quickly, and I would like to come back to your point, which you mentioned before, the accidents. One of the things what we can do is reduce speed in our cities, makes them, much calmer. In Holland, they're introducing 30 kilometers per hour in all the roads and all the streets in the city, within the city boundaries. This would really change how a city feels. I mean, too often we see that cities are like Formula 1 race tracks, and this shouldn't be allowed. These are places where people live. So what we should be doing is promoting the 30 or even better 20 kilometers per hour, but I think then we don't move so much. But this is, I think, that can be done fairly easily, although in practice it seems to be a bit more difficult because there are different governments dealing with the issue. Unfortunately, too often the electric car is seen as the solution, and I don't think it's the solution. It's reducing a little bit of air pollution, it's reducing some noise, but it's still a car. People don't get physical activity, takes up still a lot of space, a lot of public space that we can use much better. And therefore, we're actually looking for different forms. And that's why I think we should be promoting active transportation or public transport. I will be using the bicycle here as an example, but the rest applies to walking and public transport as well. Partly because we know that many of the car trips are less than 5 kilometers, and they could be easily replaced by cycling. And if you think you can't cycle, there are nowadays also electric bikes. I mean, I'm not in favor of them, but it makes it much easier, and the hills are not an excuse anymore. This is a study we did in 167 cities in Europe. We know that cycling has many health benefits. You know, you get much more physical activity. It's good for the environment, good for climate, because no CO2 reductions, good for the economy, etc. And what we looked at here is what is the relationship between the availability of safe cycling infrastructure and the mode share of cycling. And what we found that up to about 25% mode share of cycling, so 1 out of 4 trips taken by the bicycle, there was almost a linear relationship between the availability of safe cycling infrastructure and the mode share of cycling. After that, it actually broke down. But for me, it's kind of the point that safe cycling infrastructure is a prerequisite for people to get them cycling. And that's often mentioned that, you know, I don't want to cycle, it's too dangerous. So you need to give safe infrastructure. Also, we estimated that in all these cities, what we had, if we push up the mode share of cycling to 1 out of 4, we could prevent over 10,000 premature deaths in these particular cities each year because of the increase in physical activity that goes along with the cycling. Recently, there was also a study looking at COVID-19. As you know, many cities increased cycling infrastructure. Many also didn't. And this is a group that looked at the difference in cycling uptake in the cities. And they found that in the cities where they increased the cycling infrastructure, the cycling rate went up by about between 11 and 48%. So when you build cycling infrastructure, people actually start cycling. And I think that's important. It's the same, by the way, for walking. It's the same for public transport. Finally, that's what I said, greening, it's so important. We need to green our cities. Many cities don't have enough green. We have many benefits. I mentioned some of the health benefits, but you also mentioned some of the benefits on the environment, mitigates air pollution, heat, noise levels, helps a little bit towards the CO2 sequestration, but the off-surface is too small to make a big contribution. And what we could do is by replacing roads and the infrastructure that we have currently for cars with more trees. I don't say we need to get completely rid of the cars, but reduce it. We actually can change an urban environment that is detrimental to health to something that is beneficial to health. And I think that's important. What is mentioned over before, I think we need to do it all together. I mean, I'm a public health physician. I can say what is bad, what is good, but I can't make the changes. So that's why we're working with urban planners, transport planners, but also with the education sector, for example. Too many kids are being taken to school by car, causing a lot of air pollution around the schools, etc. We need to work with these people to actually make a change. I'm from the Netherlands. I'm a bit biased about cycling, and everyone always thinks that everyone has always been cycling in the Netherlands, but it wasn't always like this. Look at Amsterdam in 1971. A lot of cars. I mean, this is what we have nowadays for many cities, what we see still. And now it's what we see in 2020. I mean, it's the same road where people are cycling. This is what we should be aiming for. I mean, this is what we, makes it possible. The same here in South Korea, in Seoul. I mean, 2003, where they tore down a motorway and put actually more green space and also a river there. I mean, a much better environment. Actually, it didn't affect the traffic much. I mean, people just stayed away from it. Here, this is a planning in the Elder Hospital, the Children's Hospital in Liverpool. On the left side is the old hospital with a park next to it. They needed to build a new hospital. They asked the children, what do you want? The children said, we want to have more green space, to be out and about. So the new hospital was built where the park was, on the ground to a large extent. And the old hospital became park, so they had more park space. What we need to make sure is that we build in green space, walkable environments in our daily life, I think. One of my favorite streets in Barcelona is Rambla de Poblenou. I don't know how many of you have been there, but if you go to Barcelona, go there and walk around. This is a street, a walkable street, as you know, for the Rambla. Pedestrians are allowed in the middle, cyclists on the side. You have green space. People actually live there. There are many shops around, there are restaurants around, you've got everything. Unfortunately, sometimes you have to go to work, you have to get out, but otherwise you just can hang around there and have a great time. And the beach is at the end. I think we need more ramblers, as the popular now. We need to have more of them in each neighborhood in our cities to make this kind of attractive environments that are also healthy. It's my final slide. I hope I made a point that there's a relationship between urban planning, transport planning, how people get around, environmental exposures, and morbidity and disease. If you invest and design a city for cars, for example, if you put more infrastructure there, you're going to get more air pollution, more noise, heat island effect, stress, less social context, less physical activity, and you get more disease. On the other side, if you invest more for active transportation, you get rid of many of these externalities. You give people more physical activity, and you keep people healthier. So let's all work together and make our cities healthier, and at the same time also more livable and also more sustainable. Thank you so much.
Thank you very much indeed, Mark, for that marvellous presentation and sharing with us the results of your research. I'd now like to, as we move to the third part of the meeting, I'd now like to introduce the moderator for the second panel that we're going to have this afternoon. And this is Camila Caminavera from the Geneva Cities Hub, who's a big partner of UN Habitat and UNECE. Camila, over to you.
Thank you, Graham, and thank you for everyone. May I invite my speakers, honorable speakers, to sit there. And we have some speakers online, so it will be a perfect hybrid conference. Continue to be. Yes, please. So thank you very much. A lot have been said in a general and concrete manner. And right now we are getting really into the concrete matters with practitioners, with people coming from ministries and also mayors, a little bit to tackle those questions, tackling the health in the cities. Until now I've been to a lot of panels, and I presume you too, where we speak about pandemia, COVID consequences, then others speaking about other health problems. And this is really, if I may say, holistic panel about health in urban area. And this is the added value of it, because as we heard previous speakers, it was about mobility, about air, about climate. So I will give you the floor in order to bring even more concrete questions and answers to this holistic health approach, which has been designed by UN Habitat and my dear colleague and friend, Graham Alabaster, who invested the whole thinking into this. Thank you, Graham, for having us. Our first speaker is Dr. Onyeka Erobo, who is a senior health advisor to the mayor of Freetown, and we've seen mayor of Freetown to the Forum of Mayors in Geneva and other forums in Geneva and New York, sharing experience about health issues and how it is dealt in Freetown, Sierra Leone. Now, Dr. Onyeka Erobo, who is the advisor to the mayor, will share with us her inclusive, data-driven approach to address health challenges in the city. This is in her portfolio. She's a medical doctor. She worked on many issues like reducing food insecurity, design and implement the urban family initiatives, and many other issues. Dr. Onyeka Erobo will join us online. I invite...
Can you hear me?
Yes, absolutely. Please have the floor.
Good evening. I bring everyone very warm greetings from Freetown, from the mayor of Freetown, Mayor Yvonne Akisoya. Thank you.
Yes, please go ahead.
Okay, thank you so much. It's a pleasure to be here this evening, and there's so much to be unpacked during our discussion on tackling urban health challenges in a changing world. The first thing I want to discuss, which has already been highlighted by previous speakers, is the fact that we have urbanization occurring at a very rapid pace in many cities across the world. Freetown, which is the capital city of Sierra Leone, is not excluded from the effects of rapid urbanization. Over a span of about 5 years, we have seen the population of Freetown triple from 500,000 to almost 1.5 million residents. We have various drivers for this rapid urbanization, some of which we understand, but some of which remain misunderstood or poorly understood. But the one thing that we have seen is an increase in informal settlements in Freetown. Unfortunately, about 35% of Freetown's population reside in these informal settlements. These informal settlements are characterized by inadequate sanitation, substandard housing, poor waste management, poor solid waste disposal, lack of access to potable water. There are all sorts of poor situations that we see in these urban settlements. And then the thing that is striking is that when we talk about health in urban centers or health in cities, we always say that health in cities is, better than what holds in rural areas. However, even within cities, even within Freetown, we see that there's a difference in health status, but also health outcomes across different parts of the cities. And over time, we have seen a widening gap between the haves and the have-nots in Freetown. And one of the things that following the COVID-19 pandemic, one of the things that has become very, very obvious is that we need to focus on informal settlements. We need to focus on how to improve the health and well-being of residents within these settlements. And most times they are often ignored, but we are spotlighting the importance of dealing with this very vulnerable and marginalized population. We are focused on improving living conditions. So right now we are upgrading several informal settlements. We also have various initiatives to try to understand these disparities in health and these inequalities that that people in these settlements experience. And for this reason, we are thankful that we've had several research teams currently undertaking several studies to identify the factors that drive migration, but also the issues that these residents experience, and to be able to assess their needs so that we have the information that we need to drive decision making and policy. We have talked about the greening of cities and how that contributes to improving the health and well-being of residents. I don't know how many of you here are familiar with the Transform Freetown agenda. One of the key initiatives under the Transform Freetown agenda is Freetown, the Tree Town, which UN Habitat has been very helpful in providing guidance for. And what Tree Town, the Freetown initiative is targeted at is planting 1 million trees within the span of 2 years. The COVID-19 pandemic slowed us down, but I am happy to say that we are back on track towards achieving this objective. Currently, we have about 557 trees already planted around strategic parts of Freetown. And one of the outcomes of this is that we have seen a reduction in flooding within our city. Freetown is a coastal city and is very prone to flooding. As a result of our as a result of our Freetown to Treetown initiative, and flood mitigation plans that we have put in place, we have seen a reduction in flooding. But another thing is that these trees that we are building, with these trees that we are planting, we hope we'll be able to reduce our carbon footprint, but also serve as platforms for, climate adaptation and mitigation. I want to also talk about what the COVID-19 pandemic highlighted for our city. So many times we hear about cities being at the forefront of COVID-19 response and recovery. But I want to emphasize that it's not enough for us to say, oh, cities are at the forefront of this. And as a city, Freetown has done its best to drive progress. But one of the things that we learned from the COVID-19 pandemic is that progress cannot be driven alone. Progress cannot be driven by any single municipality. A holistic intersectoral approach is needed to drive progress and see the change we want to see in our cities. Many times what we have is an overlapping of jurisdictions. For example, when we talk about food and transport and roads, and each ministry, each department, each agency is collecting data and working in silos. And what we have is that we are unable to connect the dots, regarding these health outcomes, the impacts of urbanization, what exactly is going on in different parts of the cities. And because of it, we tend to have, a response that is not holistic, a response that does not necessarily meet the needs of the people. And so one of the things that we must remember as we move along in discussing urban health is the need for holistic intersectoral approach, the need for collaboration and a coordinated response, the need for communication, including information sharing, the need to leverage city networks to learn best governance and planning practices, from one another. And the last thing I would like to mention at this point is that many times we should remember that the resources, even though health requires a holistic intersectoral approach, most of the resources for public health often, sit at the national level. However, most of what needs to be delivered in order to address public health challenges is local. And so we must continue to advocate for national governments to equip and empower local authorities with what they need to improve the health and well-being of city residents. Thank you.
Thank you very much, Dr. Robel. Holistic approach, holistic data approach, and trickling down the finances, what we'll retain from this. Thank you for being with us. Now I turn to my right-hand side and turn to Ms. Rutina Moddaik. Ms. Moddaik is the Director General of National Landscape Department, Malaysia, and she's working on, as in this position is clear, on many issues, but mainly landscape policies and transformation of urban landscape. And I've read in some journals, international and local, that you are very specialized in transforming these urban landscapes. So would you tell us more about this, please?
Thank you, Karin. First, I would like to thank the UN Habitat for having me today here. I would very feel delightful to be part of the panel. We have listened a lot of issues in the cities related to health and the present situation that we have in our cities. And for Malaysia, I think we face the same problem, and I think actually from the global report in 2010, it was recorded that 36.1 million deaths around the world is caused by 4 non-communicable diseases. I think everybody knows about that. But the reason why it happened mainly in the urban area because of the inactive personnel, because of lack of certain infrastructures that relate to the situation that make people move around. So I think I'm going to go just to explain what is happening in Malaysia, what I have been doing. Then I think everybody know about Kobe Call for Action, where we also encourage people to create more spaces or more area that will improve the health in the cities. Well, in most urban cities, the high-density settlement may offer some environmental and economic advantage, but it also imposes health-oriented and psychological demands that are distressing. Then, and it also stimulates the desire for people to demand to be in contact with nature. So I think what is important from the perspective of urban design and city planning, addressing urban health issue through ecological landscape design adaptation is one of the approach that we have to look into for the future cities design. In reshaping and restoring the urban environment and the quality of life through ecological landscape, it is important to create a space for the urban settlement to give us a space where people can enjoy and work as well as settle in a very conducive living environment. So in urban area, most of the problem that we face, as mentioned by most of the speakers, is related to health, pollution, and also a lack of basic clean water, and also lack of in most of the cities, what we are facing in our country is a lack of clean and clean water and also sanitation is one of the issues. So I think for the purpose, so today I would like to just give some highlights on the key remedy actions, suggesting in the planning and the designing of urban greenery in the urban ecosystem towards the improvement of the physical and mental health. One is that we have to design and allocate functional and dedicated green connectivity for micro-mobility, and it has to come with a wise consideration to make people walk, cycle, and use of public transportation. I think we, as mentioned by most of the speakers earlier, that we have to set an international and global level. So the principle in designing the cities is actually agreed upon, that the fundamental of having a healthy city is you have to have a good and green, more green spaces. Urban green is an effective instrument in tackling urban heat island, and I think it is imperative to design cities with a lot of open outdoor spaces such as plazas, squares and parks with green canopy. In Malaysia, we need a good green canopy because our temperature is very hot. So you have, when we design public spaces or outdoor spaces, it must be planted with a lot of trees to encourage people to walk and to encourage outdoor mobility with, because the temperature is ranging from 25 to 30 degrees Celsius. So, but it can be done by having a good or a collaborative effort by every professional involved in city planning to create the spaces and encourage people to walk and also use public transport and cycle to the designated intention places. Thirdly, I would like to seek a cooperation from the city implementers to widely adopt the nature-based solutions approach and also a biophilic design concept in the urban development as a way that we can revert our daily engagement with the nature. So I think that is the main thing that we have to look into, and it should be done globally. So the implementation at the city level can be based on the agreed collaboration among all the cities around the world. With that, I thank you for having me today. Thank you.
Thank you very much. I think she deserves also applauses because she mentioned a lot of time green landscape, green transformation, and that's a nice color. And basically, in one sentence, what you are saying is to join Mark, we shall make more Ramblas. Thank you for this. Our third speaker will join us online, and this is Miss Ana Paula Matos, who is a deputy mayor of Salvador. Ms. Matos is specialized in humanitarian sciences. She is a teacher, a lawyer, but also administrator and employee of Petrobras. So she touched on many fields, huge experience, and also holds a postgraduate degree in corporate finance and a master in administration from a famous university. So she began her career as municipal management specialist, and I think, Ms. Matos, you'll be familiar with what we already spoke about, and you will share your experience as Deputy Mayor of Salvador. Please have the floor. And she's online. Do we have the connection? Okay. Excuse me. So we will come back to Ms. Matos after. So sorry if you are ready. That will be you now. I will speak again. Sorry for this. So Mr. Salman Rashid Al-Abasi, I hope I pronounce it well, is a career diplomat from Bahrain and also at the desk of Sustainable Development Goals, Energy and Environment, a huge portfolio, in the Ministry of Foreign Affairs of Kingdom of Bahrain. Welcome to be with us. So you have worked extensively on these projects, on these topics within your capacity, and also you have liaised and worked with many UN agencies. I cannot mention all of them, but UNDP, also ESCFA, which is the Regional Commission, UN Habitat, obviously, as you are here, but also UN Women, FIO, and many others. So you joined the corpus of diplomacy in some years ago, and you worked on this important topic which you are handling now. With this, I will not prolong anymore the presentation, give you the floor directly.
Thank you so much. And allow me to thank the government of Poland and also the United Nations, and especially the United Nations Human Settlement Program, UN Habitat, and the World Health Organization, the WHO. Both are invaluable for Bahrain in their support and in their collaboration and partnership. We are totally thankful for them. With regard, first of all, allow me to put Bahrain on the map to you so you can visualize with me. Bahrain is a small island developing state, an archipelago in the Arabian Gulf, which has borders with Saudi Arabia, Qatar, and Iran. It is a country that experiences climate challenges, which includes rising sea level and extreme heat, which every year we experience record-breaking temperature. It is a country with a high population density, the highest in the region. It is a country multicultural, multi-denominational, and its main challenges, I call it challenges, that we do not like to call like health crisis or environmental crisis. We like to call them challenges because it presses governments to work and compete and try to do its best for its people. Upon the onset of the COVID-19 back in December in 2019, we had nothing in place, basically. But we had a visionary leadership. We try to call ourselves as Team Bahrain. We work all together. When we did first learn about the virus from the WHO, 1 month before the first case ever announced in Bahrain, we have taken upon ourselves as government to deal with the situation and to not stop achieving the Sustainable Development Goals. We had created parallel lines to continue on doing business as usual and to do whatever it takes to implement the Sustainable Development Goals and to keep our rank as a leading country in developing such goals and achieving them, and at the same time deal with the COVID-19 challenge. And we have dealt with the challenge by 5 aspects that we adopted and we pledged ourselves to take. Firstly, we have proactiveness and alertness. Secondly, community partnerships. Thirdly, it was dealing with the economic and psychological effect. And fifthly, we are part of this world and we have to share our responsibility as we are doing in other challenges that we face globally together. So such holistic approach is our approach in Bahrain. And we were not perfect, frankly, but we did what is in our best. So far, we are a country of 1,500,000 in terms of population count. 600,000 are citizens, which is 45% only from the total population. So we have migrant workers, we have people who choose Bahrain to be their place of residence. And as I said in the beginning, we are a country multi-denominational and multicultural. We had to take serious steps. For example, Muslims go to mosques. This is their lifestyles. Christians go to church. We had to maintain, and even Jews go to the synagogue. We have to maintain social distances. And before knowing about the virus, this is a challenge to how to convince all people that now it is a serious thing. But because of the community partnerships, we are able to have even 50,000 volunteers from the people. Once we announced that we need volunteers, we have taken steps to limit the challenges that contributed to the virus. So we created social distances. And we also created recreational through the government steps. So we founded some new cities in Bahrain, not during the pandemic, but we started earlier to make sure that we have afforestation and recreational places in place. So when a state of emergency or lockdown took place, we are totally ready for it. And allow me also to say that it is when you have a holistic approach, when you include civil society, when you not include also international organization, you'll be able to achieve success stories. And we Since 2018, we have a healthy city in Bahrain, which is the city of Al-Hassam. And recently, in 2021, we were able to achieve another healthy city with the collaboration of the UN Habitat and the WHO, and we got our capital city accredited as a healthy city, which is, for us, is a challenge. And at the same time, we succeeded in maintaining such a city, which is a capital that is founded in 1345 and announced as an official capital in 1922. So, and it has the great number of the population based in the city. So what we focused on the quality of services, we focused also on enhancing public health and protecting the environment at the same time. For that reason, Bahrain is responsible only for 0.07% of global emissions nowadays. So thank you so much.
Thank you very much. Really enlightening. Again, retaining from you the holistic approach, which comes back, but also one other thing you said, very important, even the small states or the smaller states, they have a shared responsibility. So imagine what the big states have. That's another topic. Thank you very much for your intervention. My last speaker in this order is Suleiman Abdulmuni Iwa, whom I've met online already, so it will be again online. Suleiman Abdulmuni is a deaf sign language user and a grassroots disability rights advocate and humanitarian actor who is passionate about the right of persons with disabilities, and he hugely cooperates with international organizations, UN Habitat mainly, and others to dispatch his key knowledge. He has also key engagements in different associations of persons with disabilities, and he is current chairman of the Joint National Association of Persons with Disabilities, Federal Capital Territory Branch, Abuja, and has been very active and vocal in enforcing the human rights of persons with disabilities, and also a player in designing the strategy of UN Habitat while dealing with persons with disabilities. So, Suleiman, I hope you are online, and I hope that you hear me and see. Now is your turn. And he is not connected. Okay, that's the story of the hybrid meetings with its limits. So hopefully we were here, and hopefully also, as I said, and Suleiman and Anna are very, how can I say, very active and passionate to cooperate with the international community. I've seen them in other forums, so we'll have also other opportunities to see them. So what will be happening now? I will revert the moderation to Graham. You please stay here on the podium, and the other last panel speakers will join Graham on the podium for the last part of the panel.
Thank you very much indeed, Camelia. So we now move to the last section of the programme. Thanks for all of you for staying with us this afternoon. We now go to a small sort of rapid fire session where we're going to hear from some of the partners and practitioners in WHO and UN Habitat and partners on some of the new approaches and exciting things on urban health. So I'm going to ask them to come up. Have we got enough seats for everyone? Yes, I'm going to ask them to come up. And I'm going to introduce them as they come up to save time. First off is Dr. Natalie Robel, who's the head of urban health in WHO. Natalie is the lead for WHO's work on urban health. She's been working with WHO for several years. She, as a technical officer in the WHO regional office in Bonn, Copenhagen, where she's responsible for environmental health. She has a PhD from Reinhold Friedrich Wilhelms University in Bonn, Germany. Natalie, welcome. And our second speaker this afternoon will be Dr. Noor Absalan, who's the head of Unit of Strategic Information and Response at the World Health Organization Global Malaria Programme. Previously, he worked with Kemry Wellcome, where he was the Wellcome Trust Fellow and Director at its Nairobi programme, and is a visiting professor of molecular epidemiology at the University of Oxford. So, Absalan, it's marvellous to have you online. Our third speaker will be Sarah Beeching, who is the founder and executive director of Austrian Partnership, a social enterprise consultancy firm committed to international development campaigning. Sarah, you're very welcome. And our final member of this panel this afternoon is Sam Nduguna. Sam's one of the UN Habitat family. He's a national officer on urban law and governance, working with us for over 6 years with a specialisation in international comparative urban law and governance, and he will be sharing with us some of Habitat's work. So with that quick, rapid introduction, I would like to ask Natalie Robel to give her presentation, either from here or from there as you wish.
Thank you very much, Graham, and may I kindly ask maybe to share these slides and also to have them perfect. Thank you so much. Thank you. So maybe just before I start, two quick corrections. The first one, you make me younger than I am, Graham. I've been working with WHO almost 20 years, but thanks for making me younger, it's good. And the reason why I'm mentioning this is that actually just to highlight that urban health has been at the core of the work for many, many years. And I started in the regional office for Europe and then moved to Copenhagen and then to headquarters. And just to say that this is something that is really at the heart of WHO's work. It's going to really be a quick introduction to some of the work that we are doing and highlighting maybe some of the issues that are of most importance for us today. Over the last couple of decades, actually, WHO has been working with partners on a large number of different tools, looking at sectoral interventions and how actually to enhance the collaboration between health and other sectors that are relevant for health and well-being. And certainly you can see on these slides a large magnitude of products. This is certainly not exhaustive. Much more has been done, and actually even more recently in the response to COVID, a lot has been produced to really support cities that have been at the forefront of the pandemic to respond to the COVID impacts at the urban scale. Now, this being said, a lot has been done also on bringing cities together and actually in enhancing the leadership capacities of cities to address health. Age-friendly cities, healthy cities, the partnership for healthy cities looking at NCDs. So all these activities are actually key for enhancing the collaboration and also the learning experiences between cities. And we're very happy for those who were able today to attend the WHO event at the booth to have the mayor of Katowice, who launched actually his participation to the age-friendly cities and communities. So he's going to be one of the champions in that regard. But what I would like maybe to emphasize is that while WHO has been working on urban health for decades, there has been actually the approach that has been taken has been very sectorial, looking at urban health from an environmental perspective or from a health promotion perspective or from an emergency response perspective. But there was an understanding that actually there was a need of bringing all this together because all these areas are cross-linked, they're interrelated, and the examples that have been shared by our local representatives really highlight this. So within WHO, there was a recognition that while urban health had been dealt with, there needed to be a stronger investment by WHO of putting urban health higher on the agenda. And one of the decisions taken under the current leadership was to create a function that is the role that I've been given to cover, to support countries in collaboration with all our colleagues across the House to really put urban health high on the agenda. So what I would like to do in the last really few minutes is highlight 3 areas of work that we are currently working, or that we have been actually working on in the last couple of months, that really show this new, if I can say, or reinvigorated approach to urban health in WHO. The very first one is what we call the repository of WHO resources, so local action for health. And I'm really inviting all of you to join us at the WHO booth. There is a computer that you can try, you can use. And what is this repository? It's actually a one-stop shop where local practitioners, local leaders, those who are working on the ground to really address health and well-being can actually go and see what WHO has produced on urban health, or to support to address urban health. So it's not about going and looking on air pollution. It's not looking physical activity. It's on the pages of WHO. But in one place, find what has been produced over the last decades. And we hope that this is something that really is going to be helpful. The second example that I would like to share, and this is actually a sneak preview. When you go to these movies and you know that a movie is going to come out, right? You have a sneak preview a couple of days earlier. This is a sneak preview. So you are the very, very first one to see this, in the sense that WHO has been working over the last years to develop a common urban health research agenda. You may know that WHO, one of the mandates of WHO is to, provide leadership on research priorities. So we have been working with partners, with the International Society of Urban Health and many other partners, UN Habitat and many more, to develop a research agenda on urban health. What should we be supporting, right? What should we be promoting? So this is a document that has been produced. I'm going to you see 4 of the main highlights here. So it's strengthen the links between urban health and research findings and action. So the link between research and action, building city-level evidence on the relationship between not only environment, but environment, economic, social factors. So how to bring them together. Generate evidence for under-researched thematic areas, but also generate evidence for the vulnerable populations. And underneath those priorities, we have made concrete recommendations for research. So this is a product that will be launched very soon. And so I was saying, this is a sneak preview. And this is another common approach that we have taken to bring together WHO's work in one place. And last but not least, certainly we can speak about urban health. We can speak about frameworks, strategies, a lot of things. But what we need to do is strengthen the capacities of local governments, of the professionals on the ground. And we need to do this in collaboration with partners. So WHO is aiming at developing a comprehensive urban health training. And this is actually one of the flagship, products to be delivered by 2023 as a way of really leveraging on all the work that WHO has been doing on specific entry points to urban, but to bring them together. So we are aiming at really enhancing the capacities of local entities, national ministries, but also trainers, and really to support stakeholders in addressing, urban health priorities, building the capacities on thematic, priority areas, but also on leadership functions, on how to intersectorally, bring the different players together. So this training will hopefully be ready by the end of 2023. And I'll stop here. I could go on for, ages, but it is just to give you a sneak preview of, and also what will come, but also what has been done to bring all those areas together. So thanks, Graham.
Thank you very much, Natalie. Our next presenter is actually online. I've introduced Noor already. I hope, Noor, that you can hear us. And we're ready for your presentation, please.
Thank you, Graham. I hope you can hear me.
We can hear you loud and clear.
Thank you. Please, if possible, put up my slides. And while the slides are coming up, I just wanted to say it's a pleasure to be with you at the World Urban Forum. And today I would like to talk about malaria and urbanization. As you know, malaria is a vector-borne disease, and it's therefore very much determined by the environment. Urbanization modifies the environment significantly, and that has consequences for malaria transmission. Malaria is, Again, urbanization, again, as many of you would know, is increasing rapidly in the low and middle income countries in particular. And in many of these countries, malaria is endemic. If you could go to the next slide, please. And you see that in sub-Saharan Africa, next slide, please. You see that in sub-Saharan Africa, where you have 98% of the burden of malaria, majority of the population will be urban very shortly, in fact, in the mid-2030s, and a considerable, nearly 60% potentially by 2050. And so urbanization is both an immediate, a medium-term, and a long-term challenge for malaria. Next slide, please. In many ways, urbanization, despite all the other health risks associated with it, can be positive for malaria as the environment gets modified, and that reduces malaria transmission overall. However, there are inherent risks, and one of the most important risks is the intense transmission potentially in informal settlements with poor housing and poor drainage, and very few people with immunity, and therefore the risks of epidemics. The other inherent feature is the potential for invasive vector species, such as Anopheles stevensi, for example, that's happening in the Eastern Horn of Africa. And so there are positives and there are negatives for malaria when it comes to urbanization. Next slide, please. As a result, we at the WHO, in collaboration with the UN Habitat, and I actually present this jointly, decided to bring together experts to develop a WHO framework for response to malaria in urban areas, with the aim of providing guidance to countries and identifying important knowledge gaps. Next slide, please. This technical consultation, which took several months, was actually opened by the Honorable Yvonne Akisoya, the mayor of Freetown, who actually inspired us with her Transform Malaria agenda, which was presented a few minutes ago by her representative. And this essentially underpinned a lot of the thinking around the urban malaria framework. Next slide, please. And as such, we had several consultations around 5 main themes on prevention of malaria, the delivery of healthcare, urban governance policies and planning, multi-sectoral support, and surveillance mapping and analysis. The technical consultation had 120 participants, over 30 sessions, over 33 presentations, and we pulled together the draft framework, which we're still working on and hope to launch this year in collaboration with UN Habitat. Next slide, please. The draft content covers several major issues. It has a summary section, which is the framework at a glance, a session on what urbanization means and how to define it, a vision for malaria response in urban areas, a guidance on how to implement this, and a final sub-chapter on research and development. We're doing this work, as I said, as WHO with UN Habitat, but internally within WHO in close collaboration with the UN, the WHO Urban Health that Natalie represents. Thank you very much.
Thank you very much indeed, Noor, for that quick presentation on the joint work we're doing on urban malaria. I'd like to now ask Sarah Beeching to come and share with us on the Healthy Cities, Healthy People initiative. Sarah.
Thank you, Graham. Can I have my slides, please? Great. Thank you, ladies and gentlemen, for having me here today to talk to you about healthy cities, healthy people. This has been developed with city leaders, with partnering with UN Habitat, with the Commonwealth Local Government Forum, and with a range of technical expert partners. Without health, we've got nothing, and I think we need to find a way to put health at the centre of our city agendas. We need to focus, on what we can do to support the people living in cities to live healthier lives. We saw the devastating impacts of COVID on our economies and on the lives of individuals. And Healthy Cities, Healthy People has focused particularly on the diseases that affect the most vulnerable, so vector-borne disease, neglected tropical diseases, and tuberculosis. Our world is changing fast. All global health bodies have reportedly said that more disease threats will come as we encroach more and more on wildlife habitats, as we move more into cities, as we travel more, as we become more interconnected. Around 75% of emerging and re-emerging diseases are zoonotic in origin. Think of the origins of COVID-19, of HIV/AIDS, Ebola, Nipah, monkeypox. All of these diseases have made the leap from animals to humans. The COVID pandemic highlighted the many existing inequities and divisions in urban centres, and the One Health principles, this linkage between human, animal, environmental health, are increasingly being seen as essential to effective disease control. We need to find ways to link our knowledge and our surveillance data on human, animal and environmental health together, find platforms to actually talk to each other across these sectors. Many of these interventions need local level data and they need local level action. Sierra Leone has been a great inspiration actually to us. It was wonderful to see Dr. Onyeka with us earlier, but this is a city and a country that's put in place a One Health platform following the Ebola crisis, and they're able to bring together that expertise in one place. Through COVID, we learnt about the very real importance of prevention. We saw the limitations to our health services when they were overwhelmed with sick people. We learnt about the importance of community-level action. Local conditions, even within a city, varied greatly. We learnt that investment in prevention has never been more critical. Our work on Healthy Cities, Healthy People started before the pandemic, but of course was greatly influenced by it, as mayors saw the responsibilities that were being heaped upon them, often with very little support. We started in 2019 on World Malaria Day with a commitment from Francophone mayors on malaria in cities. And the Mayor of Freetown, once again, the Honourable Mayor Yvonne Akisoya, agreed to champion a similar commitment on behalf of Commonwealth mayors. In partnership with UN Habitat, WHO and a range of experts, we undertook regional meetings and further consultations to develop a Healthy Cities, Healthy People common position and commitment to action. This was a declaration where mayors committed to focus their efforts in a multi-sector way across the sectors to deal with neglected tropical diseases, mosquito-borne disease, and they particularly asked that tuberculosis be included. In November 2021, we launched the Common Position online. It was endorsed by over 40 cities and organisations. And last week, it was included in the Kigali Declaration on NTDs, which was launched at the Commonwealth Heads of Government meeting in Rwanda. Alongside this commitment, leaders endorsed a call to action on sustainable urbanisation across the Commonwealth. Countries have woken up to the need to focus attention on building healthy and resilient cities, but now we need to turn these political commitments into action. And Healthy Cities, Healthy People focuses on the environmental factors which must be addressed to prevent disease. Better water, sanitation, solid waste management, housing, planning, drainage, and I'm going to say dog population management and vaccination, which is important for rabies control. Many of these indirect, non-health interventions fall under the direct responsibility of local governments. So the next phase of the work, we have a commitment, we have a declaration, we know that there is political support for engaging at city level in multi-sector action, but how can we turn that into something that's operational? So working with UN Habitat, we've conceived of the idea of a challenge fund and a funding accelerator, which aims to improve delivery of preventative approaches to disease through a two-phased approach. The first is using a challenge fund to kickstart processes of project development, very much taking a neighbourhood, local level approach, working with communities, working with local leaders to identify, prioritise and implement demonstration projects in selected areas. But the aim is to use this as a catalyst, and a catalyst to accelerate accelerate action on the bigger infrastructure programs that need to take place. We know how difficult it is to actually put together investment propositions for multi-million pound, 10-year, often longer infrastructure investments, and yet this is what's required. So we're using this small-scale approach in order to prove concept and work with the more traditional finance institutions to get their support and to amend projects that are already existing, to have much clearer focus, not just on the nuts and bolts and the engineering practicalities of delivery, but actually on how better interventions can improve health as well. COVID-19 shone a spotlight on the vulnerabilities of our cities everywhere. We saw how health systems struggled. We saw how our economies suffered. We need to be better prepared in the future, and this starts by ensuring that we use every tool in the bag to tackle endemic diseases that we know about, diseases that are already there. Because only by getting better at tackling the diseases that we know about will we be better prepared for any new disease that might emerge. If we can't monitor a disease that exists, and I'll use rabies as an example because the data is extremely weak on the incidence of rabies, how will we pick up a new disease X when it arrives? And we need all sectors to contribute to better health outcomes, to come together under the leadership of the people who know their communities best, our city leaders. It's critical that we learn from this pandemic and ensure that we're better prepared next time. Thank you.
Thank you very much indeed, Sarah. Thank you for staying with us again, and thank you to the interpreters for hanging on just a little bit. We've got one more short presentation. So on that note, Sam, I'd like to ask you to come and present on behalf of UN Habitat. Thank you.
Thank you, Dr. Graham. I'll be very brief because we are running out of time. I would like my presentation to be, yes. So as Dr. Graham mentioned, my name is Samuel Njuguna. I'm one of the junior staff working at UN Habitat. I got inspiration to work on this topic on urban health, and I decided to develop a normative tool that they are over there. But I'll give a snapshot in terms of what the tool entails. So globally, UN Habitat is helping authorities at different levels to identify successful policy, legal and governance measures and approaches to respond to COVID-19 pandemic in cities, towns, communities and informal settlements so that the most vulnerable people are protected. I think vulnerability is an important aspect when it comes to urban health and other issues that we have in our urban areas. So basically what we mean by this, we mean that measures need to be tailored to different types of situations so that all urban actors, including service providers, communities and civil society organizations and the private sector, can work in a coordinated and integrated way to limit infections and respond to the crisis. I'm tempted to skip this slide because I want to go to the tool, but since we have it there, so basically urban governance offers an opportunity to respond, recover and build long-term resilience, and I'll get into more details on that specifically on multi-level governance. So the challenges in redressing health inequity still persist because of weak governance structures, which are as a result of fragmented decision-making amongst different urban actors. So we have the national, regional, and local governments, private sector, civil society, and the community. But as you can see from the screen, 90% of COVID cases are in urban settlements. Local authorities and their partners are really on the front line for fast response, management, and recovery. And through our research, we have found that multi-level governance has helped to achieve the best results in the pandemic response. So based on this, we have developed a guide on multi-level governance and health equity to expand on this. So the publication actually has twofold objectives. So the first one is how to achieve transformative impact by placing people's needs at the center especially the vulnerable groups, through multi-level governance. And then the second objective is to showcase ways in which institutional frameworks can leverage multi-level governance for future health crisis preparedness and equity. So I think Natalie touched on the health equity aspect. So, and I think the panels which are here in front of us, I think the discussion was around that healthcare is not only about access to just healthcare. It's about prevention measures. It's about healthy urban design. It's about improving air quality. It's also about protecting biodiversity and also mitigating the spread of diseases. So I think WHO is very expert in this field in terms of the principles to eliminate health inequities. So we have availability, accessibility, acceptability, and quality as one of the principles. So in terms of availability, there's need for a sufficient quantity of functioning public health and healthcare facilities, goods and services, as well as programs for all. In terms of accessibility, here we mean issues to do with non-discrimination, and information accessibility as well. When you come to acceptability, we talk about the respect for medical ethics and the need to put in place or rather take care of the needs of the diverse population groups. And finally, in terms of quality, we are talking about the facilities, goods and services must be scientifically and medically approved, and a key component of this is the universal health coverage. So one of the innovations about this toolkit is there's demand from our partners and also from some of the discussions we've had to kind of talk about the bad side of governance. I think maybe as international institutions we shy from discussing things to do with corruption, but this tool really goes into this. So as you can see from the slide, poor governance practices such as corruption affect universal health coverage. And this has severe consequences for access, quality, equity, and efficiency of health services. So from our research, we realized that an estimated $500 billion US in public health spending is lost globally to corruption every year. And apparently, these lost funds are sufficient to achieve universal health coverage. And another finding from our tool is that most anti-corruption tools do not assess high-level corruption in the health sector. So moving forward in terms of our research, we think that this gap in both practice and literature needs to be addressed. So as I promised, I have come to the end of my presentation, but just to mention that multi-level governance is really an important component for urban health equity, and there needs to be collective action, cooperation, solidarity to rebuild the social and economic fabric of cities to be more resilient and sustainable at every level of government and at every part of the world. Thank you so much for listening.
Thanks very much indeed, Sam, for that nice rounding up at the end of today's session. I'm just going to take 30 seconds to share with you some of my thoughts from the amazing today, the presentations that we've had. We've gone from one side of the world from the other. We've looked at different levels of health governance and management, and we've heard both the theory and the evidence from Mark and the practice from all our practitioners at various levels. So I think for me, I found it a very enriching, meeting, and I think we've had some very interesting, results come out. I'm not going to attempt to cover all of the conclusions that we've had, but it does seem to me that, we really need to take modifying our urban environment much more seriously if we're really going to achieve some of these huge health gains. We heard a lot about the importance of green space and about managing, air pollution, traffic, these sorts of things. We heard from several speakers about the need for a holistic approach. But, we still haven't quite got there with some of the tools that we need to do this, with some of the governance approaches that we need, with some new and novel ways of introducing projects to bring and attract finance. Because at the end of the day, and I think it was put forward by Sam's point at the end, that, if you look at the money that disappears in corruption, how that could be, improved in efficiency, and if a small proportion of the investments that go into rebuilding cities and their infrastructure you know, we could really gain a huge amount from improving people's health. So we've got to aim to think outside of the health sector as much as we can to stimulate the investment and to bring resources into these new and existing urban centres. Many of the urban centres we heard, of course, haven't yet been built, so there's still time for us to bring in some of our ideas and approaches. So on that note, I would like to thank all of the speakers and contributors to this afternoon's event. Thank you ever so much to those of you here, to those online, for your fantastic words of wisdom and for sharing with us your thoughts. Thank you to those in the audience who've stayed with us and to those who are online. And of course, I would also like to thank our interpreters there at the back for all of their efforts. We very much are thankful for your help. So on that note, I wish all of you a very pleasant evening. Thank you again from the bottom of my heart for your contributions, and I hope you enjoy the rest of WWOOF. Thank you very much.